Welcome to Adapting Class. This is a continuation of our community health nursing topic. This is a topic you have to know. Sometimes you go and that's all they give you. Few of them, if you know it, they're very straightforward. So I have some 10 questions for you. So this is same thing, test taking strategy, focusing on um, community health. Of course, you got to read the question from the back. Which action should the nurse prioritize? She has to do something, not to be idle. And nurse is triaging. A nurse at the triaging stage area receive a client with visible chemical burn residue and burn to the skin after a factory explosion. So factory exploded, and there's a burn, there's a chemical burn, and there's even chemical residue on the skin. I've underlined it by as well. Those are the things you need to focus on and use it to answer the same questions on your own. Create it on your own. That means you're taking care of the patient with the burn, residue burn, and then it come to you at the triage area. What do you want to do? It can be chemical, it can be bioterrorism. It's the same thing. What do you want to do? The first thing you need to do is you to wear PPE. After you wear PPE, then get the patient to be decontaminated. Now, if the patient is decontaminated, then you take care of them. These order has to go. You always want to protect yourself as much as possible. Unless the patient is dying in front of you, yeah, you still have to wear PPE and start assessing them. But when you want to assess them, take them to the decontaminated area while you're removing their clothes, you're assessing them. But this patient, I tell you, you just walk in. So the first thing to get closer to the patient is to wear PPE. So move the client to the safe, decontaminated area is a good idea, but that's the second step. Don a personal protective equipment, then approach the patient is much better. If this answer there is not there, then taking the patient to the decontaminated area is the best. Remove client contaminated clothing and begin immediate irrigation. Of course, you have to do this at the decontaminated area. So you have to move them to the decontaminated area. This is the first one. Then you move them there. Assess the client condition. This is after they are the decontaminated area. You decontaminate them, you assess them. Unless they are having airway issue, yeah, you still have to don your PPE. So don't forget your safety, everybody's safety is much better. So don't PPE. Which of the following the nurse should include? A nurse is presenting at a community health fair on how to prevent botulism. Botulism is one of the bioterrorism problem is Clostridium. You can use it, but the problem is it's fine in food can. You don't get it from just by getting contact with me, right? You eat it, either you give it to a kid who is like less than a year old or a can, that food can that has been there and the gas that is produced by the bacteria, you see that the can is bulging. So that is the key. Children under 1 year should never be given on it, right? Discard bulging food can is a very good preventive measures. Avoid consuming food from a can. You can eat food from a can. So far as it's not old and it's not bulging, straight hand hygiene with soap and water will not prevent it. So this one. What is the nurse priority action? A community health nurse perform home visit for an elderly client. The nurse observed atypical bruises on the forearm, which the client claimed it happened after a fall. What is the nurse priority action? When it comes to abuse, there's always strategy to answer question. You should have it packed in your head. That's what I call adapting class test taking strategy. Nurse priority. And then what is the next thing? Atypical bruises. That's I suspect a kid that is abused or an elderly patient abused. What would I do? I need to report it. I need to text somebody. I need to figure out. But the first thing is your suspicion is not enough. You saw the bruises. Patient told you I fell. It does not jive with the information we get. Get more information. Do your assessment and document your finding. Then go and figure out. Confront the caregiver about their bruises. Well, you don't have documentation. You don't have more information. If you suspect an abuse, just the bruises and all is not enough. It's a suspicion. Figure out if the client is eating, drinking. So assess their nutritional status, their hydration status, When was the last time they take their medication? When was the last time they've been seen in a hospital or their dentition, their clothes? This will tell you this patient is neglected and abused. Probe the client for the definitive answer. He or she is not going to give it to you. Prove the client's son about the injury. It's going to be mad. This one, get more information. Which of the following the nurse should include and prioritize? Prioritization 101. You got to be sharp. All the answers are appropriate, but you got to pay attention which one is the best one. A community nurse is educating several parents in a community health fair about prevention of epiglottitis. Keyword I'm going to underline. When you're taking the test, I want you to do the same thing. Epiglottitis, prevention, include and prioritize. What causes epiglottitis? It's a bacterial problem. How do you prevent it? Immunization. That's all. Immunization. Most epiglottitis is caused by foreign body aspiration. It does not do that. Exposure of allergy increases the risk of epiglottitis. It causes asthma. There is no role for antibiotic in the management. Antibiotic is good for when they come in, they have severe disease. Standard immunization during infancy can prevent it. You get it 2 months, 4 months, and 6 months, and 8 months. It's very good. Which of the following is an example of secondary prevention in a community health? Secondary prevention is you screening, 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 screening. That's your buzzword. Which of these I'm screening? I'm giving you flu, I'm not screening. I'm preventing it from happening. Primary prevention. For scoliosis is key. So screening high school students for scoliosis is key. That's screening. Promote Promoting safe care practice to prevent STD is teaching them, right? That's not screening. Providing cardiac rehabilitation service. They have a heart problem. You're providing rehabilitation is a tertiary prevention. Which of the following patients should the nurse prioritize for care? Prioritization. That means they're sick. This is triage question for community health. After a tornado, a nurse is assigned to triage victims in a community. 45-year-old closed femur fracture is bad. 28 years old, penetrating chest and dyspnea, airway problem. 70-year-old with confusion, small laceration, neurological problem. 16-year-old with sprained ankle. Don't worry about it. Orthopedic problem. So yeah, small laceration to his head. He's confused. He's in shock. Anything like that. But if you have penetrated wound to your chest and you have dyspnea, probably you have pneumothorax. This will kill you first. Which strategy is the most effective in engaging this population? Public health nurse is planning a smoking cessation program for adolescents. Test taking strategy. Step back, look at it, and say, "Whoa, what did they give me? What strategy is most effective?" That's the key word right there. Most effective. Okay, well, most effective engaging this population. What population? Adolescents. What do they like? Hey, on the social media all the time. You go and target them. If it's elderly patient, your strategy will be different. If it's toddlers, which they don't smoke, but I'm using an example, it's different. If based on their age group, you target them, right? Every time they give you a question about age, they put it a toddler, teenager, adolescents, or other patient. Focus on what they like. Distributing educational pamphlet about risks of smoking, they're not going to read it. Hosting a lecture from a local physician on the danger of smoking, they will be sleeping. Using a social media campaign and promote quitting smoking. Of course, they will be on their Twitter all day, Facebook. They will be looking for it, see the video. Requiring students to attend mandatory smoking, they will never come if it's mandatory. So the right answer, as you can see, is social media. You want to target the individual based on what they're good at whenever you're doing prevention strategy. What is the next priority intervention? Be sharp. And next, identify high level of lead in the water supply of a local community. Too much lead. What do you want to do? Do you go to the family, educate them about lead poisoning? It's already there. Referring affected children to the pediatric specialist, the lead is still there. Notify public health authorities immediately. They will come and remove the lead. Advocating for funding to replace lead pipe. Of course, after the authority know about it. So this is the best way. I'm showing you how, if I'm taking the test, that's the way I should be talking. You should talk to yourself and say, and so what? And so what do I do? I got to be sharp. What is the priority nursing diagnosis? A nurse is visiting a client with limited mobility, living in a cluttered house. So you live in a house that is cluttered, right? A lot of things on the floor. What is the nurse priority nursing diagnosis? Every time they ask nursing diagnosis, find the problem. What is the problem? The place is cluttered, right? So many staff over there. And then how is this going to affect the individual? That's how you make nursing diagnosis. Always look at the condition that has happened and how did it relate to the risk of social isolation. This is the room being cluttered is not going to cause social isolation, right? Risk of infection related to unclean environment. How is cluttered environment? It does not cause infection. What is going to cause is falling, right? Risks of injury related to environmental hazard. This is an environmental hazard. Falling to the patient is a problem. Impaired home maintenance related to physical restriction. The home is not impaired, except it's just cluttered. So, risks of injury. And the last question, what is the primary goal of this intervention? A school nurse implements a vision screening program for kindergarten students. Vision program for kindergarten. Why are you doing that? It's to find who is in trouble. That's all. Promoting early academic success. Vision has nothing to do with early academic success. Complying with state health requirement. Of course, well, there's no state requirement to have a vision screening program. They are not hospital, right? Detecting vision problems early. Well, if you have a screening program, what do you do? Detection. You see test taking strategy, go for the buzzword. Whenever you screen, you're doing what? Early detection. I tell people all the time when they give you a question, sometimes the answer choice will have the same definition in not all of them. So don't just use that. But if you're having problem trying to find the answer, find something. Screening program is early detection. They changed the word detection early. That's all. Educating families on the importance of eye clinic. That's not the idea. The idea is to have a screening program is to detect something early. If you do that, NCLEX will be easy. Thank you for watching. Take care of yourself. If you know a member, join our Adapting Class membership. You get videos like that. If you want to know more, subscribe to Adapting Class. You can see it down there. And join us in our crash course that is coming out in January 2nd. Take care of yourself and bye.